It looks like I was very much ready to give my mini test, but in real life, I wasn't. If you felt like these 3 days were a little too fast for you to study surgery, then I am with you. If we have 3 months, we could keep it a little longer. I left my active recall halfway through. Hi guys, welcome back to my YouTube channel. My name is Dr. Simar Kochar and I'm currently preparing for NEET PG 2026. So as you all know, we have started this 92-day journey for clearing NEET PG and we've started with our cycle 1 with the subject surgery. I hope you all are also following along with this schedule. Talking about that, I completed my surgery cycle 1 yesterday and then I gave my mini test on Core BTR app. If you felt like these 3 days were a little too fast for you to study surgery, then I am with you because I also felt it was a little fast at pace for me. Thinking about if we have 3 months, we could keep it a little longer, but let's just push ourselves in the first cycle at least, and so that we get a pace of it. And that was my main purpose why I kept it for 3 or 4 days only. If you feel like you couldn't complete your entire Q bank before you went for the mini test, or you felt like you couldn't actively recall the entire thing straight away, so that was me. I left my active recall halfway through. I watched the video, and then when I was about to revise my video doing active recall, I left it almost midway. I was so tired of reading that topic. What I did then was I went straight into my practice questions. If you're using Core BTR, you would know that when you complete a particular section of questions, your percentage of completion starts increasing, and so mine still around 70 or 80%, which is fine. It's okay. You don't have to force yourself. My point of not completing my entire Q bank was because I had to give my mini test yesterday, and if I was already doing so many questions, 100 questions already, then I wouldn't be able to use my brain while I'm actually giving the mini test. So I stopped when I felt like I was getting saturated. Obviously, we are going to read surgery again and again after this day. So don't feel like today is the last day of reading surgery. It looks like I was very much ready to give my mini test, but in real life, I wasn't. There were a few backlogs I had, and I still have them. I haven't completed my choti copy. In fact, I've just made 2-3 pages. I'm going to come at the choti copy discussion a little later in this video. I also want to add here that the last video about the baseline GT, I discussed in detail my corrects, my incorrects, my rank, my percentage. I don't want this to be the pattern that we follow coming forward for mini tests especially, and I don't want this to be a comparison place that we compare our marks with each other. This rank, this marks are not our ultimate goal, and I just want to see how we grow together. I don't want to feel superior or inferior to anyone, and I also don't want that for you guys to feel like that. So I'm just going to talk about my percentile and actually active blunders that I have been committing. The mini test was of 100 questions and my percentile came around 90%, which is good for the first test. But mind you, I have been revising my surgery since almost 1 year. So this is how far I have come right now. So don't compare yourself to the percentile. This is just for my accountability. The blunders that I committed out of the 100 questions were 7, which is not a big number. What I did differently this time was I gave my GT, baseline GT, sitting on the bed. Now I gave my mini test sitting on a table and chair, and I kept my phone away. I kept all the distractions away, and I saw the difference in my result as well. New info was around 13 questions, but the new info was in such a way that you could easily rule out. If you know Zainab ma'am's pattern of putting tests, she always puts questions so that you can take out the three options that are not correct out, and then you can actually come to the answer. This new info was, I wouldn't say it was a new information, but it was something to practice ruling out. The topics that were repeatedly being asked in the test were, first of all, breast, the topic breast cancer, breast abscess, you name it, classification of breast cancer, luminal, luminal B, everything in detail was asked. And the second topic, that I would say, trauma, ATLS, basically everything. It could be urethral trauma, it could be renal trauma, it could be penetrating blunt abdominal trauma, any kind of trauma. Almost we had 10 or 15 questions entirely dedicated to trauma. So trauma is very important. If you don't know where to start, just go ahead and start with trauma because it's very important. And the third topic that I would say is very important is thyroid. I think everyone who's reading surgery right now knows thyroid is very important, breast is very important. But I am just highlighting which questions were repeatedly asked in this test. There was a question on Paget's disease, which was interesting. There were direct questions on genetic testing of breast cancer. Another topic that was asked again and again because it is being asked in the exam also, ERCP. So ERCP is a very, very important investigation that you need to read in detail about bile injuries, bile leaks, and everything related to it. And the gallbladder part of the hepatobiliary surgery is very important. So make sure you read that. Hernia was also being reflected again and again, and hernia has also been a weaker area for me because there are so many classifications, there are so many names, there are so many relations. Umbilical hernia and congenital inguinal hernia was asked in this particular test. Colorectal cancer and its management, surgery, low anterior resection, abdominal perineal resection, all of this was being discussed in the test as well. Pancreas has been my nightmare. I don't know why I hate it, but pancreas is one of the most important topics in surgery. So please make sure you read it. This test was full of vascular injuries like aneurysms, and then there is AV fistula. So I would suggest you should go and revisit that as well. There were some here and there questions like burst abdomen, abdominal compartment syndrome, nerve injuries, the first page of core BTR that you see. It's a very important page, and my that page is quite weak, so you should definitely go through with it. My personal blunders from the test were I got some trauma questions wrong. Either you get confused in the radiological investigation or you get confused in the stable and unstable management. So it's very inevitable to avoid questions from trauma to get wrong. Also, another blunder that I actively made was must classification for malnutrition assessment tool. I wouldn't say it's very important, but it's a fact that if you know, you're going to get it right. HCC's management according to BCLC, I flipped pages while I was studying that. So yeah, I would go back and read that. Asia scale for trauma is very important. And one question that I actively get wrong. I think if I've seen 10 questions of it, 9 of them I've got them wrong. And there is always this one topic that pinches you every time because everyone's getting it correct and you somehow would never understand why you get it incorrect. This is for me dumping syndrome. I don't know why I get it wrong so many times. I've written it so many times on pages. I have written it in my choti copy. I still get it wrong. SOD dysfunction was a new thing for me because I just couldn't diagnose it from the history that was given and the Milwaukee classification I had no idea about. And aortic injury, as I said, vascular injury was an important topic. While I was studying for this surgery cycle, there were a few weak areas that I felt were there in my revision. I tried to keep all of these in my choti copy. So these are my weak topics that I'm going to revisit again and again, and I'm going to put them in my choti copy, and you can see them. In the end, I would want to say that test was towards a moderate to moderately tough side because there were very new topics and very new things that were being discussed in the test. But that is the point of giving this. You get to gain more knowledge. For example, if you are reading notes and you are watching videos to gain more knowledge, I would say you should rather attempt questions because of two reasons. One, you get new information that you learn every time you attempt a question wrong or maybe correct by chance. You try to read in depth about it and then you get to know where you went wrong. And secondly, once you get something wrong, it's a higher chance that you will remember what mistake you made than you just reading it in a piece of paper. Get as many questions wrong as possible. I would suggest take every question personally, seriously, and to your heart. You will stop getting those questions at least wrong. So you're actually reducing the Q bank that you are making wrong. That is all I would want to say. Action plan after test is I'm thinking I am going to revisit surgery at least after 10 days since I haven't fully made my choti copy. So I am still waiting to for more subjects to come into it, and then I'm going to read it every day. And also I want a quick suggestion from you guys, that I have tried making a choti copy before, dividing it basis of the sub facts, scores, classifications, managements, blunders. I have divided my choti copy once before, and it didn't work for me. It was too chaotic. I just couldn't club things into one. I just couldn't keep it in my brain like that. So I've started making choti copy, just the topic wise, the topic I'm studying, I'm just going to write it on the copy. Do you think that is the right way to make a choti copy, or should I switch it? And if you have any ideas for that, please let me know. I really need help regarding it. And that's all for today's video. I hope you're going to start with your Orthwin radio from today or tomorrow. I hope you are following this schedule religiously and you're studying every day. I wish you all the best. Take care. Goodbye.